Obamacare healthcare exchanges. They are a huge part of the Affordable Care Act. And, of course, the rollout of the exchanges, like it or not, is this week. Truth is, nearly two-thirds of Americans have no clue what to expect about all this. And it's clear even the people implementing Obamacare don't know what to expect. However, they do produce some nice, slick propaganda videos.
So, what is a health insurance exchange, anyway?
Well, think of it as a large online marketplace that gives individuals and small businesses access to insurance options.
Okay, sounds good. How does it work?
Glad you asked. It allows uninsured individuals to compare and shop for quality and affordable health plans, and insurers a way to compete for individual customers. So exchanges give you access to a range of plans, whether you're a student, you run a local bakery, or are a stay-at-home dad.
Gotcha. But what does it mean for me?
Right now, if you were to shop for insurance, you'd be on your own, and it can get pretty complicated. Soon, most of us will be required by law to purchase health insurance, including you. And exchanges will offer a more streamlined way for millions of Americans to compare and select insurance. Got it?
Yeah, I think so. Thanks.
Yeah, thanks. Now, only 14 states have set up exchanges, and the remaining 36 are being set up and run by the federal government. And they are not all created equal. Joining me now, private medicine advocate and Obamacare expert Patricia Newman. Okay, you saw that little propaganda video. It looks all nice and clean, and everything's going to be wonderful. The problem is there are some major flaws with these exchanges. Maybe we'll get to that in a minute. But first, can you tell us the difference between, in your opinion, what it's going to be, between the state-run exchanges, like, for example, in the state of California, versus the ones that are run by the federal government, like the state of Texas?
Right. The difference is not that it's not that different, actually. They both offer health plans. They both are part of the exchange. The basic difference as far as the funding is, of course, that the ones that are run by the states are getting federally subsidized, and so they get a little help from our friend in D.C. The ones that the federal government is going to run, those 36, are from states that didn't want to participate. They didn't want to get into this mess, so now the federal government is going to have to do it themselves. And as far as the cost, you know, when the state ones seem to have a lot less options because they're trying to minimize the cost. So, you know, on that little propaganda video, you saw all these aisles of choices.
Right.
Not really, no.
Yeah. Well, we're hearing story after story about these health insurance companies bailing on the exchanges. In California, big ones opted. I think Aetna was one of them.
Right.
We're seeing it over and over and over again. So these massive choices that you saw in that video simply aren't there.
No, they're not. And just this morning, actually, there was some breaking news that there are 10 states, and most of them are progressive states. They are the ones that jumped in. The major payers like Aetna and even some of them, Blue Cross Blue Shield, Anthem, are pulling out of the exchanges, not only of the individual market, but they are also pulling out of the exchanges themselves.
Okay, what's a qualified health plan? I mean, we have all these terms now. Qualified health plan, essential health benefits requirements. What is all this stuff?
A qualified health plan is one that meets the essential benefits, meaning the government decided what are the things that have to be covered under Obamacare, and these are very generous benefits. So those are the essential benefits. And the benefits include hospitalizations, emergency room, outpatient care, laboratory, pharmacy, maternity, newborn care, behavioral health, even, substance abuse treatment, pediatric care.
So the government is dictating what should be in the policies,
yes.
Correct? And that's what's jacking up the premium.
Absolutely. In the past, the younger people would select plans that were considered skimpy. Well, skimpy,
right.
Why? They're healthy. They don't need maternity care. They don't need the coverage for diabetic treatment. But because the government got involved, and now all of these, essential benefits have to be included, which, it jerks up the price. And in some instances, it really jerks up the price a lot. There are plans that, for example, in Tennessee, you know, a young 27-year-old healthy guy pays right now $41 a month for their plan. They're going to have to pay $114 a month for this.
Right.
For, you know, yeah, okay, so they're getting better coverage, but they don't need the coverage. So,
but in reality, what we're hearing is the estimates. Again, there's a big unknown out there, but the estimates are that the premiums are going to range between $300 and $500 a month, and you have the president out there last week saying, hey, it's going to be no more expensive than a cell phone bill. Well, maybe his cell phone bill is $500, but mine's not. Right.
It makes you think, okay, was he lying or are the Republicans lying, saying that it's going to cost a lot more? Well, what the president didn't tell you is, you know, he didn't complete his sentence. It is going to be 16% lower than the original Congressional Budget Office estimate. So, yeah, deceivingly, he was right, but not really. It's just going to be higher.
Well, he also said if you like your health insurance plan, you can keep it. And clearly, that's not coming to fruition either. He also said that the average plan is going to cost $2,500 or less a month for the family of 4 or whatever. Right. That's nonsense at this point. Now, I'm looking at a piece of paper here. It says in California, 58,000 people are going to lose their health insurance under Obamacare. Maryland, 13,000. South Carolina, 28,000 people. These are real people losing their health care coverage because of Obamacare. My question is, why is there not a tidal wave at this point saying, hey, stop this thing, let's, you know, jump on board with the Republicans and get this thing defunded?
I don't understand that either. I think it's the lack of information. The voter is, you know, is just apathetic about news. They're not going to realize it until it hits their pocket. And by that time, the ones that are going to be subsidized are going to be just fine with it, which unfortunately is going to be a lot of people. And so the taxpayer needs to revolt because they are going to be funding it for everybody else.
In other words, like heroin, they'll get hooked on it. The people who are low income and getting the subsidies, right? The people who are getting the direct deposit into their health insurance accounts of your tax dollars and my tax dollars, right?
And it's a vicious cycle too, because the employers are going to be paying higher premiums. That's going to force them to, you know, put everybody on a part-time job, less than 30 hours. So all of these people then are going to be eligible for subsidies. It's a vicious cycle of economic destruction, and it's also destroying health care. It's just not a good outcome. This is going to be horrific.
More on that next time, Patty. Thanks for all that.
Thank you.
Coming up next, Democrat name-calling over Obamacare as the Daily Ledger continues.